I'm John Torres, a psychiatrist up in Boston. I also have a background in engineering, so I'll explain a little bit about the project we're doing. But I think to introduce what we're doing and why is, I'll give a clinical case, I'll anonymize it, but we had a patient come into our emergency department when I was on call, and clearly had bipolar disorder and was manic. And what we do for most patients who are of a certain age, we call the parents, because he's in college, and we called the parents and they said, well, we know he's manic. I said, how did you know that? They said, well, he sent us this long travel report he's been doing by searching the internet of where he's going to go, what he's going to do. And that's always what he does before he has a manic episode. And I said, well, did you tell the college this? Didn't you try to stop it? And they said, well, the college didn't care. We told the counseling center, they said, that's internet search data. That's not clinical data. And I think that case, in essence, exemplifies three issues what's happening. Internet search data is definitely correlates with people's change in mental status for some people. People share it with people they trust. He shared his kind of internet travel plans with his mother. And third, the healthcare system doesn't know how to handle this data, right? The college counseling center said, that's not actually a real signal. So what our project aims to do is three things. First, we're going to work with a group of patients and clinicians to really understand what do people want to search and what do clinicians want to get. We don't want to get all data in the world. We're very busy as clinicians, but there may be some things where maybe this patient says, I'll share with you searches around travel history. It doesn't have to be personal data. Maybe clinicians will want to do that. So we're going to learn how to ethically get the data and to get the minimum amount of data to be useful. The second part, as I have here, is our team has built a different type of outpatient clinic in Boston, where we see people completely virtually, and patients have telehealth video sessions with us. But between sessions, they use a smartphone app to share information on their steps, their sleep, their mobility, things that really help us understand the behaviors and healthy habits that go into mental wellness. So what we're going to do is, once we've understood the ethics in part one of how to share the data, we're going to ask patients, would they be willing to integrate this data into their treatment? Could we use the data to help make people better? And we're excited to kind of learn about how the healthcare system actually have to use the data. And the third part is we're excited about is we're using the internet search data in real patients in care. Again, with permission and ethics, can we use to say, can it help us better predict who's going to become unwell? So we started with that case, right, on a patient who had a manic episode. Could that data actually help us build on, say, the mobility data we get from patients, the sleep data, the surveys they take on the phone out of sessions, maybe be a little bit better and move towards more of a prevention model. So we're very grateful for AcademyHealth and the Gordon Ben Moore Foundation for letting us do this journey.
Great, thank you, John.